Hello, my name is Dr. David Porizo, and I'm the medical director here for Marque Medical. I'm also a board-certified internal medicine doctor and a board-certified cardiologist. A sports physical is like any other physical exam you perform on a patient, but it is geared toward looking for cardiac abnormalities and orthopedic abnormalities that might put the athlete at risk for an adverse outcome like sudden cardiac death or orthopedic injuries or so forth. I would have to say that I think that sports physicals are more important now than ever, given what we've gone through in the last year with the COVID-19 pandemic. Viruses have the unique ability to attach themselves to certain tissues and cause significant damage, and one of those is the heart. You may have heard about myocarditis. So other viruses can do this as well. Other coronaviruses can do this as well. And we've seen this in some patients following their COVID diagnosis. And that's what's called myocarditis. And from there, they can develop heart failure and what we call cardiomyopathy. These are, very dangerous things. They can lead to sudden death, heart failure, decreased longevity, and so forth. So you definitely want to find out if you might have had or you do have a post-viral myocarditis, especially after a COVID-19 infection, because this has been documented. The other reason it's important is COVID-19 also affects the lungs, and so it can cause interstitial fibrosis, which is again something you would look for on examination. You would hear certain sounds when you listen to the lungs. This might prompt you to get an x-ray, and if abnormal, might prompt you to get a CT scan. So it's really important that a medical provider lays hands on anybody who's about to resume physical activity after they've had a COVID-19 infection, to make sure they haven't suffered or are suffering any of the complications related to that illness. So here at Marque, we do have the ability to perform some ancillary tests that might help us in determining whether or not an athlete is going to be at risk for participation. Probably the most important thing we can do is an electrocardiogram. That'll look at the rhythm of the heart. It'll also give you some insight as to the size of the heart, and in that way you can maybe find or potentially pick out somebody you think might have a post-viral myocarditis. Another exciting offering that we have at Marque Medical is a screening eye exam. We feel this is important given the amount of time that kids are spending on their screens, especially during COVID. A lot of people spent a lot of times looking at monitors and televisions and laptops and phones and so forth, and it can really affect the vision. It can cause a lot of different symptoms. And so we're offering that to our patients as well as a screening exam to determine if they've suffered any consequences from being glued to the computer too much.
We offer sport physicals at every Marque Urgent Care clinic. Schedule a reservation online or simply walk in 7 days a week. If you have any questions, feel free to call or text us. We look forward to taking care of our student athletes.